Now let's dive right in. I would like to welcome to the stage Commissioner of the Food and Drug Administration, Dr. Scott Gottlieb. Dr. Gottlieb is a, hold your applause for 1 second. Dr. Gottlieb is a physician, medical policy expert, and public health advocate who previously served as the FDA's Deputy Commissioner for Medical and Scientific Affairs. In his time at the FDA, the Commissioner has been focused on policies that can make it easier for patients to access safe, affordable medications. As you may know, Dr. Gottlieb will be stepping down from his position in about a month, so we are especially glad and grateful to have this opportunity to sit down with him this morning. Welcome, Dr. Gottlieb. And joining him on stage is my colleague, The Hill's Editor-in-Chief, Bob Cusack. Bob, over to you.
Thank you, Jack, and thank you, Dr. Gottlieb, for being with us today. Thanks to everybody in the audience, everybody on thehill.com. We're live streaming. As Jack alluded to, you created some news yesterday.
We create news every day.
Yes, you do. But this was a shocker to many. In the healthcare sector, I checked with some healthcare experts. We have a few talking today. They didn't see this coming. 2 months ago, you basically put out a tweet saying, I'm not going anywhere. We've got a lot to do. So why are you stepping down?
Well, look, I mean, Occam's razor, sometimes the obvious rationale is the real rationale. I mean, this was a job that I did 100%. I was commuting from Westport, Connecticut with 3 young kids. I would get home late Friday night, have dinner with my wife, see my kids Saturday, work all day Sunday, and be back on a train Sunday night. 2 years of that got hard. Got hard in the family. And you know, if I had to do it over again, I think I would have moved him down here from the outset, but I didn't, and it was too late to do that now. So this was a very difficult decision. Timing-wise, you know, that tweet you alluded to was out during the shutdown. I certainly wasn't going to be leaving during the shutdown. Just looking at the calendar, you know, it became hard to find a week that made sense. I knew I wasn't going to stay much longer, and you know, every week either I was testifying or the secretary was testifying, and this was a week when we had a break between testimony, and it just seemed like the right time to do it.
As far as who will replace you, and will you make any recommendations of who would be the permanent replacement?
I've expressed my thoughts, you know, privately, and I'll keep them private. I think that there's some good people being thought of for the acting position. I think in terms of a nominee, that's obviously a longer process, and I don't think that they're at the point of making decisions around that yet. But I think in terms of who steps in to fill the role in an acting capacity, there's some good names in the mix. I feel good about it, and I feel good about the people who are going to stay behind.
Do you think, what's the timing on the acting? Would you? I mean, you're going to stay around for about a month, right?
I think that I think they would want to make a decision soon and have a period of time of some transition and maybe some overlap. I think they'd want this to be a smooth transition. You know, and there's good people thinking about this right now, and I've had some conversations about it already. You know, we want to keep the FDA team intact. That's a really good team out there. I want to keep that team intact, and I want someone who has the right ethic for that agency to land in that spot.
You've been an outspoken FDA commissioner and rubbed some people the wrong way. You have launched an initiative to really crack down on teen vaping. Some conservatives sent a letter to the president earlier this year saying basically this is against the president's anti-regulatory actions, as well as it would hurt the economy. Are you confident that after you depart, that the crackdown on teen vaping will continue?
Well, I'm very confident of that, and I'm very confident that we're going to continue to advance policy on this over the next month, including the policy that we've been formulating. I think there's widespread recognition that this is a major public health crisis. I think for the vaping community and the tobacco industry, this is an existential threat. I don't think they fully appreciate what they're facing, the tsunami that they're facing if we don't get this under control. The trends are continuing to skyrocket in terms of teen use, kids' use of these vaping products. These are not safe. They're a safer alternative to using combustible tobacco for currently addicted adult smokers. But saying that they're safer than using combustible tobacco is not saying that they are safe. And we have increasing data showing that they cause direct harm on the lungs. You do not want kids initiating on these. And if we start seeing tobacco use rates in this country of 40–45%, which is quite possible that we're going to see that this year once we have the 2019 National Youth Tobacco Survey data, and we start seeing combustible use go back up, I think you're going to have a groundswell of people who are going to demand action. So I think it's very important that the agency get ahead of this, and we are getting ahead of it, and we're going to continue to advance policy. I'm very confident of that.
Last question on that issue is, are you confident that, I mean, sweeping change is very difficult to do. You have proposed sweeping change on this issue, and others too. Was the pushback from some very powerful people, did that make your job tougher?
You know, I don't, look, it'd be nice to live in an environment where you never have any opposition. That utopian environment doesn't exist. I don't think that there was extreme pushback on these policies that we advanced. The industry was always going to defend itself. There wasn't a lot of political opposition. The issues around youth use are broadly bipartisan. I think the arguments that the folks who are advocating a completely laissez-faire, hands-off approach with respect to vaping don't hold true. You know, they say, well, the kids are only vaping on weekends, they're only using it occasionally, so it doesn't matter. Well, that's not true. We're catching the beginning of an epidemic. Addiction epidemics start with occasional use before they become regular use. We are seeing the kids in their first year. You follow them longitudinally at 2 or 3 years out, they're going to be regular users. People who become addicted to opioids don't become addicted to opioids by starting to use heroin day one, by and large. They start with occasional use of a Percocet, maybe a lawful prescription, and recreational use. Then they begin to snort and crush pills. They use higher dose pills, and eventually they move on to injectable drugs. There's a transition and a progression of addiction. We are catching these kids when they're first becoming addicted, so they're only using it occasionally, many of them. But more and more of them are now regular users. The other argument is, well, you know, at least the kids aren't smoking. These kids would have smoked anyway. That's not true. That's not what the data shows. These are kids who wouldn't have smoked. We've stigmatized smoking successfully in this country. These are kids who don't equate using e-cigarettes as smoking or using a tobacco product. And in many cases, they don't even think that they're using e-cigarettes. They think that they're juuling. One of the things we did with the 2019 National Youth Tobacco Survey this year, which is in the field this month, is we put explicit questions. FDA did, worked with CDC. We did it. Put questions in there to ask, do you use e-cigarettes? Do you use Juul? And now we name the specific brands in addition to the e-cigarettes. So we're going to be capturing many more kids who are going to self-report now that they're using e-cigarettes because they don't identify it as the e-cigarette, they identify it as a brand.
Patient access to innovation. What did you learn as FDA Commissioner? What surprised you? What are the barriers to getting innovation to more patients?
Well, I mean, there's technical challenges, and then there's just practical challenges of facilitating access and trying to make products affordable, trying to make sure that you have reliable supply. I mean, manufacturing issues are not trivial, especially when you're dealing with complex formulations and biologics, things like gene therapy, cell-based therapy. I think one of the hallmarks of this sort of era that we're in, when I came aboard, I said I couldn't think of a better time to be at the FDA because of the tailwind of new authorities we had, new resources, things like the Cures Act, and then the ability to sort of set the modern framework for new areas of technology like gene therapy, cell-based regenerative medicine, digital health, targeted medicine. These are all burgeoning areas of innovation and technology that are going to have, you know, tremendous impact on human health for years to come. But we're really setting the modern rules for that right now. And I think one of the things I'm really proud of that we did successfully was get in place a lot of the guidance to establish those modern rules. And I think we did it in a way that was flexible, thoughtful, is going to allow the regulations and guidance to evolve over time as the technology does. But, you know, facilitating access is about allowing a thoughtful development process while ensuring these products are safe and effective, and then taking steps to try to invoke vigorous competition so patients can get access to them, affordable access.
What do you think is, you've made approving generic drugs a top priority. What is the federal government's role in drug pricing?
Well, I think, you know, the issue is you try to get product competition. That's my job. Part of my job was trying to get more product competition onto the market. I saw that as my sort of mission. Once you have product competition, you want to have an environment, a pricing environment that uses product competition to help facilitate discounting to get better access. You want to take advantage of competition when you have it. And then you want to make sure that that discounting is in the form of something that could benefit the patient. I think we have breakdowns on all three. I mean, I think we did a lot to try to facilitate more product competition through what we did to try to reduce gaming. That was extending monopoly and franchises past the point that Congress intended with Hatch-Waxman. We tried to push on, we're trying to push on, I I have to stop talking myself in the past tense. We tried to push on, more approvals of complex generics. I think in the payment system, we still have areas where even when you have competition, we're not taking advantage of that competition. I think particularly in the Part B side, where we don't competitively bid drugs, we sort of are price takers as a government, rather than using things like biosimilars and multi-source drugs as a way to try to inspire competition. And then when we do have competition, so we have product competition, we have price competition, the discounts come in the form of back-ended rebates in many cases that don't directly benefit the patients. The patients who are spending the money and using the drugs and who are sick and out of pocket don't see the rebates directly. The rebates are used to lower the price, the premiums for everyone within a plan. So they're benefiting patients in the end, but they're not benefiting the patient who's sick and out of pocket.
What can a lot of healthcare stakeholders here today, and there's, you mentioned the rebates and the first step therapy issue, and there's a lot of controversy over that. How can the healthcare community, which is often at odds with itself, help and eliminate some of these barriers?
Well, one thing that surprised me is the inability of health plans to sort of shift prescribing towards situations where you have opportunities to get better value for patients. And I'm thinking particularly about biosimilars. When I talk to biosimilars, I think have tremendous opportunity to lower healthcare costs. Biosimilars have had a struggle to enter the market, in part because of the stacked rebates on the incumbent drugs. What I don't understand sometimes is why the health plans can't work with the providers to help make that transition to biosimilars if they're more affordable, and the health plan can extract a better pricing on them, make that a more rapid transition. They say that they have reluctance among physicians to take up the biosimilars. My view is, one of the reasons why we have PBMs and we have health plans and we have sort of an organized healthcare system is to make those decisions and to try to, shift utilization into areas where patients can benefit, including benefit through lower costs. So, I think the healthcare system can look at ways to do that better. With biosimilars, one of the things that the health plans are going to have to think about is, when you put a biosimilar on formulary, you might lose a lot of historical rebates, and you might not be able to shift enough market share to the biosimilar to offset the lost rebates in the first quarter or the second quarter. But in the long run, you're going to save a lot of money. And I would hope that health plans would take the long view in trying to adopt biosimilars and put those onto formulary, recognizing there might be some lost money in Q1, but by Q3, Q4, you're going to save money in the long run, and you're also helping to facilitate a burgeoning market.
We have a question from Twitter from @Caroline Lee. The process for how vaccines are administered has not changed in decades. How is the FDA encouraging innovation in this area specifically?
Not really sure of the question, the way they're administered. You mean with needles?
I assume so. But what do you think of the whole controversy over vaccines? There was a big hearing yesterday on Capitol Hill about vaccines, and there's both on the left and the right, there is suspicion of vaccines, but a lot of healthcare experts say that really should not be paid attention to.
Look, these are some of the most exhaustively studied questions in modern times, scientific questions, and what we've done to study the MMR vaccine in particular to try to reinstill confidence in that vaccine is probably the largest scientific undertaking to study a single question. We proactively, I was at FDA at the time, we proactively reformulated the MMR vaccine to take thimerosal out, not because we had any concerns around thimerosal as a preservative, but consumers did, and to try to inspire consumer confidence, we worked with the companies to reformulate it. I think we have to accept that this is a debunked question. I mean, this has been firmly studied, and at some point you have to say we have enough science. We've answered the question, and I think that we've answered the question. Now, that said, I understand the concern of any parent putting a complex, what's perceived as a complex medical product into an otherwise healthy child, but we can't lose the public health gains that we've made with vaccines. I mean, they've been one of the modern miracles of medicine. I spoke before the state attorney generals yesterday from most of the 50 states and delivered a message that states continue to adopt exemption laws that are irresponsible. These aren't just state issues anymore. I firmly believe states should regulate the practice of medicine, and we should try to defer to states to set these kinds of standards and medical practice standards within state boundaries. But these laws are of a sufficient laxity that they are not just having implications for the states, they're having national implications. Borders don't respect disease, and they don't respect measles. And I think if we see the states continue to go down this path, you're unfortunately going to see more and more discussion around what we should do at a federal level. And there's quite a bit that we could do at a federal level. And I think a lot of us in a public health position are reluctant to step into this, talk about it too aggressively, because the last thing I want to do is make this a federal government versus states' rights issue, and that's because that's just going to further enrage people who want to impose, laws that might move in a direction that would be counterproductive. But I do think that there's a real risk of that longer term. That this isn't just a debate around vaccines and state laws anymore. It's going to be a debate around the whole relationship between the federal government and states when it comes to public health issues that have national implications like this.
As FDA commissioner, when you went around the country outside the Beltway, what did you hear from patients? Did you hear maybe about the right to try law, or what are patients outside the Washington bubble talking about?
I mean, I will say that as FDA commissioner, I traveled very little. I probably traveled like a day every 6 weeks. I tried to stay within Washington, tried to stay as much as possible within FDA, and that was conscious because I felt that had to be productive. I will say that the issue that came up the most when I went home, when I was at picnics, was the vaping issue. And maybe it's because of the demographic that I was interacting with. I was talking to young families with teenagers and kids in middle school. But the top issue that I got confronted with, where people were concerned, it was about youth use of tobacco products, and particularly the vaping.
From parents?
From parents. Number one issue that was brought up everywhere I went.
And did they, I mean, that's obviously anecdotal, but I know you talked about the data earlier, but you were hearing basically what was the complaint, that they're hooked on this and they're getting hooked on something else?
What was going on in schools and high schools, clouds of smoke, they were bathrooms were being locked, things were happening on buses. They would just tell me stories of what was happening in schools with respect to vaping. And this started, this started in sometime in 2018. It came on really quick. I mean, when we set our policy out in 2017 to announce that we were going to seek to regulate nicotine and combustible tobacco products to render them minimally non-addictive, to try to more rapidly transition smokers off of combustible tobacco while we extended the application deadlines on the non-combustible products to get in place the implementing regs to try to bring them through an appropriate series of regulatory gates. When we did that, we saw the e-cigarettes as a real opportunity to try to have a product that could still deliver nicotine for adults who wanted to get access to nicotine, who no longer would be able to get access to it through cigarettes, because we'd be regulating the nicotine in cigarettes and taking out the nicotine in cigarettes. And that was the elegance of the policy we put in place. What we didn't foresee, we really had no idea of how rapid the explosion would be in the youth use. And it basically was one product. I mean, it basically was Juul that drove that over the course of a year. And maybe we were a little disconnected from it because we were either too old or too young. I mean, my kids are 9 and 5, but it happened very quickly, and we were shocked. I remember the day the head of my tobacco center walked in to give me the preview of the National Youth Tobacco Survey, the 2018 survey, and he had only had it for a day or two, but he wanted to scrub the numbers to make sure they were accurate. And my chief of staff was there with me. We were shocked by the numbers, absolutely shocked.
Will the minimum age of smoking go up to 21?
States are doing it. The federal government right now we can't raise the age above 18 by federal law under the Tobacco Control Act. I would certainly support 21. I think it's going to be in play. It might be hard to move tobacco legislation right now, but I think long term it should be 21. A lot of the youth use of the e-cigarette products aren't just kids going in and buying these in convenience stores, although we see a lot of illegal sales, and we took action this week against some large retailers that were illegally selling to kids. Yep. But a lot of it is enterprising 18-year-olds buying them and then reselling them in high schools too. So I think when you take the availability of these products out of the high school demographic altogether by moving the age past 18, you're going to cut down the ability of kids to access these. This is, I've said this before, and I might have said this already today, this is an existential threat to this technology. I've told this to the industry, but we need to get control of this youth use if we want to preserve this opportunity for adults.
This is your third event with us, and there are a lot of newsmakers that we interview, and you're a pretty straight shooter. I do want to just settle this once and for all. So
that's quite a setup.
So yes, so there is no reason in any way to any policy that has led to your resignation.
Absolutely not. We had this debate because you saw the Axios article on Friday that said that another news outlet's article, excuse me, that said that my policy was now with the White House,
yes.
And and we knew that reporters were going to speculate, well, if I, am resigning Tuesday, it's because I didn't get my way.
Right.
There was always going to be something. There was always going to be another policy that I was waiting on. There was always going to be some article about something that people were speculating I wasn't getting my way on. Right. And we were aggressive. We were pushing something every week. And we were pushing things, we were taking on conventional wisdom and pushing difficult things. Yesterday, we took strong action against cosmetics and outlined a major reform of the cosmetics industry. And on any other day but the day that I resigned, that would have been covered very broadly by the FDA press corps. I am extremely confident that the policy that was reported on Friday by another news outlet will be out very shortly.
Very shortly.
Yes.
Anytime, before you leave?
Certainly before I leave.
Okay, interesting. Okay, last question. President Trump tweeted about you twice yesterday.
I got 2 tweets.
Very complimentary.
It was connected.
To be continued. And would you come back?
I'd certainly consider coming back. Absolutely. I need some time at home with my family. I had a conversation with the president yesterday. He was wonderful. I had a conversation with Ivanka Trump. She tweeted today as well. Wonderful conversation. It's been a tremendous privilege to serve in this role. I am extremely grateful for the opportunity the president gave me to do this. I remember the day I interviewed with him in the Oval Office, and he, gave me the job, and I'll never forget it. He's been tremendously supportive of me, and that's helped me get the things done. Don't underestimate the impact of when the president says positive things about, a principle, how much that can drive my ability to then move my policy. So I give him a lot of credit for all the good public health work that we've been able to do.
Well, it's been a privilege having you at our events, and we welcome you back at any time. Please thank Dr. Gottlieb.
Thanks a lot.
I'll hand it back to Jack.